All right. Well, welcome to Revolution. Tonight we have an amazing, I'm so tickled that we have Dr. Nancy Bryan again on here to talk about our amazing new product. And it's so exciting just to see what is happening with the company and with what's going on with this. Dr. Nancy's on the medical advisory board of the company. She has an amazing science background. She's a doctor of pharmacy, and you know what? She's probably forgot more than I will probably ever learn about the science on this. She's an amazing. She's very humble, and she's absolutely amazing with her knowledge, and also as an amazing distributor too. So with that, I'm going to bring my buddy Nancy on. Thank you so much, Dr. Bryan, for coming on. You're amazing, and we're excited to hear you tonight.
Oh, thank you so much. I'm always so humbled to be able to speak to other people's groups, because you know what, that takes a lot of trust, because you know what, there's a lot of things that can go wrong. So thank you so much for having me. And you know what, I can't begin to tell you how thrilled I am about where the company is going. When I first, and I'm going to be honest with you, when I was first told about this coming out, this was back last fall. All right, so go backward to September, October. A lot of things were going on in our company. We had our CEO resign. We got a new CEO that stepped up from CFO. We had a lot of things going on. And then when they started telling me about this, I'm like, really? Really? Because we're an activation company. I want to talk about activating pathways. That's what we do, right? And then they let us know the inside story. And then we had to be quiet about it. So I think the biggest challenge I've had over the last 6 months is not being like insanely overexcited, knowing what we had coming. But I will tell you that pales in comparison to what's happened, that once they gave it to us way ahead of time and we got to be the trial, when we started seeing the crazy things happening. So you know what, let me get right to it. First and foremost, I think a lot of people, especially because I love that we have guys on here, and you know what, for some particular reason, yay Gary, yay John, yay all the guys on here, because I will tell you, collagen is not kind of something they think is their wheelhouse, right? I mean, when people start talking about collagen, it's beauty products and all these kinds of things. And the thing that I will tell you is the main reason that that's happened, the beauty industry was smart enough to know and understand that it was a big component to help us look younger, which is awesome. But I will tell you, the real secret behind why they didn't get as excited as we do is because it goes back to our activation story. And the difference of what we have as a collagen, the biggest trouble that I always have is that we have a terminology and people can't begin to understand the comparisons of the terminology, if you will. So, you know, it's like saying I bought a new pair of shoes today. Well, you know what? Were they a pair of flip-flops from the grocery store or Target, or were they a pair of Gucci's from the high-end department store? You know what kind? And that's how I feel about the word collagen. It doesn't begin to describe what it really can do in our bodies. And so I just want to be able to answer a few questions today to help you to know and understand what collagen is, first and foremost, and why is it so important, and why was it that our company decided that they really thought this would be a great asset to our company in terms of activation products. So John, you know what, I'm gonna let you go ahead and see if there's specific questions you want me to go ahead and follow, and we'll go from there.
Absolutely. I have a question, not only for physical appearance, like you mentioned earlier, but if you could tell us a little bit about the importance of collagen in blood vessels, in cardiovascular health, in I'm hearing a lot about eyelashes, I'm hearing about hair, I'm hearing about joint pain. So, you know, it's far more than, you know, appearance. So if you could take it away on that, that'd be great. I'm hearing a lot about that.
Absolutely. So first and foremost, you have to think about our skin on the outside these epidural cells, all this stuff on the outside, we have all that on the inside. So just for starters, let's talk about our digestive tract. That's basically skin on the inside, right? It's what separates out stuff from the outside that's bad going on the inside. We kind of forget about those kinds of things, right? But who here has ever heard of leaky gut? When we're talking about leaky gut, we're just talking about cells. Our digestive tract lining is all a bunch of cells that meet together, right? Well, when they get all banged up and they're not holding their structure and they're not dense and elastic and all the things we need that we want to see on our skin on the outside, guess what? They shrivel up and they kind of shrink up, and then gaps start happening and things start seeping through our gut that shouldn't be. And so one of the first things that we're seeing a lot of talk about that people don't ever really think of in terms of collagen is improving the insides of our body. That includes our digestive tract. It includes our blood vessels. It includes our all of the cells surrounding a lot of our organs. Just think, on the inside, when you look at and think about your gut, you've got all these different areas and space in there. All of that has cells that require collagen. And what it does is it provides a lot of things. It provides the elasticity and flexibility of a cell, the denseness, what holds it out, what's all the stuff inside of the cell that puffs it out, that makes it look good, right? That makes it healthy so it can function. And so when we start taking a look at that, and we will start having some of those studies, I want you to be aware that we're going to be having Wellness Wednesdays with the science, people from the science board being interviewed in a half an hour setting at the company. And each of us are going to be addressing different things on a Wednesday every week, and those will be recorded. And their focus right now is on collagen. And I, in particular, will be doing the gut and collagen series in August. So those things, we're already in process of doing studies and how they're handling it. But it doesn't matter if it's your joints and your connective tissues. It doesn't matter if it's your skin on the outside, the digestive tract on the inside, your blood vessels. All of those things have an impact from collagen. Now, having said that, one of the things that I want to tell you, and I started talking about this in the beginning, one of the reasons you don't hear a lot about that from all the hubbub about collagen is most of the collagen out there doesn't do all the things that ours do. So I don't want you to all think you have to be know all of the science about every little thing that each one of those ingredients do. I don't want you to wait that long. What you need to know, the important things you need to know, is that our product activates, it replenishes, and it maintains. And people think, well, those are just marketing words. No, they're not. They're what separate us from everything else that's out there. All right. So, John, I'm going to let you go ahead and see if there's other questions that you want to ask in a question answer format.
Sure. I had another question too about a lot of people have asked me about, okay, after the first 60 to 90 days, is there a where that would be like a loading type phase to where then you would have it, you would take less of it to maintain, or do you have to continue every day with, just like Protandim Nerve 2, where you continue to take each dose per day? I mean, you don't cut back at all.
Well, here's what I'm going to say. I think a lot of it is going to be dependent on your age, the amount of damage that you have. I'm going to tell you, I'm going to take it every day. Because in my mind, just like our NRF2, our body needs that activation every single day, right? And I can tell you that if we're seeing the kinds of results we're seeing in 7 to 10 to 15 days, it's not going to take very long for that to go back in the other direction, because what's putting you on that path, again, are those three areas. We're through the ingredients, we're activating by giving the things our body needs, the amino acids and the things that our body needs to make our own collagen. that slows down after we're about 20. That's why we start seeing those first wrinkles in our 20s, right? So that's one of the things that you need to be having the thought process of, I want that activation every single day. And so, you know what? Are there going to be people that go ahead and slow down some? They may. But I'm going to tell you that when you start getting the kind of results that we're seeing, you're not going to want them to go away. Okay.
Great, great. We had also heard about, there's a lot of different collagen products on the market from a lot of different companies. And could you maybe talk, obviously ours is an activator, which makes us different from everything, but maybe talk a little bit about what differentiates us from everything else on the market.
Okay, well, first and foremost, the fact that it activates is clearly putting us at the top of the stack. What most collagen products do is they replenish. And we do that. We do replenish the collagen. So when we have, we have a marine source protein that provides 10 collagen sources. So we're replenishing what we're losing, all right? But within that, it also has amino acids from those marine collagen, from the marine peptides and amino acids. Those are precursors for our own bodies so that we can make the collagen, all right? Then on top of it, we've added in something called red quinoa, and it's kind of a grain, if you will. What it does is it allows the collagen to get into the cell. If I want the cell to become dense and full of that collagen and have that elasticity, I have to have a means to get it in there. We don't think about those kinds of things. And that's a really important key. That's one of the biggest things that separates us from a lot of other kinds of collagen, is that we're actually utilizing an NRF2 activation process of moving the collagen into the actual cells. And by doing so, we're creating not only helping the cell be more dense and more elastic, but we're helping it maintain what it has. Hence the word maintain. So we're going to lose it at a lot slower rate, and we're keeping it. And that really is what truly separates us, I think, more than anything, is the fact that we have added in there some berry and citrus extracts that are real unique in that ability to be able to have the activation to allow that elasticity and to allow the cells to bring in that collagen and to hold it in there so that it remains dense. Okay.
That's great. Another question that we've heard a lot of is people say, well, I'm taking Protandim Nerve2 and it activates SOD by like 34%, and this is 2,700%. Is that a different element of how, two different activators activating and also catalase as well too? So, I mean, if you could maybe address that too.
Absolutely. So it is confusing because I've had some people say, well, do I still need to take Protandim NRF2? I guess one of the best comparisons I can give you is the fact that our Axio, which is a nootropic, it activates NRF2 in our brain, right? So we take that along with our NRF2, that yes, it does optimize the NRF2 pathways in all of our cells, but there's several components to our NRF2 pathway. And so these are different forms of components that get the jobs done in certain areas. So for instance, like I said, we have Axio for our brain because we're going to utilize specialized NRF2 pathways for brain cell and brain tissue. Same with our skin. It has different areas. And that's why, I mean, we know that there's 20 some collagen forms, 28 or 30, somewhere in there, collagen types. Our product provides 10 different kinds. And I have a lot of people say to me, well, bovine is supposed to be the best. Well, here's what I will tell you. They're taking a look at bovine from a supplemental perspective. Bovine is an excellent source, but most of the time it has to come in a form that's powder. When you have to take a powder form, now it's requiring our own body to utilize its own moisture, its own water source, its own way to activate that again, when we're trying to do just the opposite and add more moisture. And so while that has some abilities to do some things, it doesn't come close to being able to do what we can do from, again, the activation, the replenishing, and the maintenance. And the moisture content portion of that is a big part of the maintenance, okay? So for the NRF2 question, yes, there's different pathways or different components of those pathways. These are just in addition, and think of them as like a structure supporting each other. Even our bones require, they're like crystalline crossbars, and in between all of that is collagen that needs to be there. That's why as we get older, we get brittle bones, because that doesn't have a way to get in there anymore, and we don't have enough of it. So all of those things are really important, and that's why you're seeing from this liquid source. The reason we put it in a liquid is we wanted to be able to add and help maintain the moisture content within our cells in our body.
Okay, great. Can you talk a little bit about the specific amino acids that it provides?
Well, there's several amino acids that are involved, and I really don't want to get into a ton of deep chemistry, because then I think people get deep into that. The thing that you need to know and understand is that the amino acid components are building blocks. And so they're like precursors to putting together other things. So when people say to me, well, do you have type 3? Do you have type 8? Do you have type, what matters is we have type 1 and 2, which are the primary sources in our system. That's 70 to 80% of the collagen type that we need is type 1 and 2. The rest are there almost as precursors and building blocks for some of the other things that have to happen. And they're very specific for different tissues. And so it gets into really deep biochemistry. And I don't want us to have to go there. What I want us to know and understand is the reason we put things together like this is just like in the beginning when we had our NRF2. They studied hundreds of combinations of different herbs to get our NRF2 activation underway. And when they found the 5 that they have, that was the optimum. That's what happened when we put together the marine peptides, amino acids, along with the red quinoa. There's a synergy that goes on because our body, what does it want? It really wants food, right? It doesn't want all these chemical components. It wants food. And guess what? There's probably still a whole bunch of things we still don't know. Even though we think we know all the chemistry, we don't begin to know how all those combinations work.
Perfect. A little bit, this is a funny question. I have a new person taking the product, and she's a beautician. She's owned the salon for years, and I wanted to get a hair perspective from her. And when I talked to her this morning, she told me that she feels that this product starts building the hair from the inside out. That's how she explained it. She said you could just tell the texture of your hair. And so can you elaborate on that a little bit? Because that's really exciting to be able to have, a beautician really, and she's been on it for like maybe 10 days and she's seeing that difference. So
it's so crazy. I mean, first and foremost, and that was one of the reasons we came out with our shampoo line. Our hair follicles on our head produce more than 1 hair per follicle. Okay. As things get weaker and they don't get the nutrients they need and damage happens, sometimes they quit producing any hairs, right? And that's where we have, things, we have genetic pattern baldness, but we also have disease baldness that can happen from all kinds of disease states. And so when you think about it, I mean, just think about how crazy our body is. It produces this. That's, to me, it's just like we're a manufacturing process to make this. It's just incredible. But I will tell you, that is what happens. Within that hair follicle, the use of collagen is putting together. And if you have a better collagen and a more dense collagen and several sources of it, okay, so we have those different types, that's going to allow for, again, the things that we might not know all the chemistry of. but it does change your hair. My hair texture has definitely changed. I've been on the product now for, I'm going to say probably 12 weeks, 10 or 12 weeks. And my hair definitely, and it's crazy. You can't think that you're going to feel that. But that's why we're seeing things like our eyebrows getting heavier. My eyelashes have grown incredibly. Our nails are, you know what, so much stronger. All of those things are getting the raw materials they need again. And that's how you have to think of it. You just think of it as like having the complete recipe. When you're making that special recipe that was grandma's recipe that made it that special recipe, now that's what our body is doing, is getting all the unique special things that it needs to complete the job.
Okay, I think we have time for one more, Dr. Nancy. Talk about osteoporosis with this. Could this, do you think, is this something that could help improve that bone condition?
Absolutely. Remember I talked about that lattice work, that matrix of bones? That's exactly what happens is we have the bones, and then in between all of that, what holds it together is the collagen, right? That's what's keeping it more flexible. That's what's making it, you know what, just like our skin needs elasticity, just like we need all of that ability for it to be flexible. That's what happens in our bones. Osteoporosis, basically what happens is the bones just get weaker and weaker because that lattice work is not holding together and it becomes more brittle, okay? So yes, we still need our calcium sources and vitamin D and all of those things, but this is like the raw materials, again, that are actually really helping to give the flexibility and the cushion inside those bones. And so, yes, I think that we're going to see some incredible, I already know from some of the studies and results we have, we've had a very clear picture of what it's doing inside bones and joints, which is just extraordinary. And you know what? I think that we're going to see it everywhere from gum tissues. Just imagine that inside for dental. That's going to be huge. All of those things. And again, why I get so excited about it, this product has the ability to do things a lot of the collagen products out there don't do. That's why you don't hear these things about those products, because they're replenishing, but they're not activating. And you know what? Nothing works better than our own body making something.
Awesome. Anyone else have any other questions for Dr. Bryan?
I have a couple, if that's all right, John.
Yeah, absolutely. Take her away.
Hi, Randy.
Hi, Nance. One I think you covered, but just a little point of clarity. I was speaking with someone today and I was telling about the collagen, and I brought up the fact that the LifeVantage collagen works on 10 different types of collagen and most only 2. But my concern then was, what if he says, well, what are they? So is it better just not to bring that up?
You know what? First and foremost, they're by type. I will send that to you if you do need that. I can help you with that. We do have a list of those.
Do you think it's important?
I don't.
Because I think that's more important when I was explaining the activate, replenish, nourish, and why that is better than anybody else's.
I much prefer us to talk about that, but if they want to know that deep information, we have it. And I'll be happy to send that out for those of you. Sarah Harding did an incredible job, and I'm more than happy to get that out to John for the rest of you in John's group. For those of you in my group, I have that information from Sarah. She did an incredible job breaking that down. But the bottom line is, it's not going to, unless they, you know what, I have a master's in biochemistry, molecular biochemistry. And having said that, guess what? I don't care. It doesn't matter, because the chemistry of them working together is what I'm talking about. I'm talking about the synergy of them working together. And I'm much more interested in what we're seeing happen and get done, and the results of our studies and the pictures we're seeing from people. But if they want it, we have it. They won't understand it, but they'll probably be fairly impressed that you have them. The thing is, there's 99% of the collagen out there is only type 1 and type 2.
Okay. So then I understood we touched on bones. I have a lot of athletic people that I talk with, and the first thing they bring up is, what about cartilage?
What about cartilage? Big
What
time.
about cartilage? Yeah. So,
Because the cartilage, if you think about it, that's our cushion between the hard bone, right?
right. But you should notice some type of significant effect over time.
Oh, absolutely. I do believe that we'll see that over time. But again, if you've worn down the cartilage to nothing, this goes back to me talking about NRF2 pro tandem. If you cut off your arm, you're not growing a new arm.
Right.
If you stop producing insulin in your pancreas, you're not going to get new insulin. You're still diabetic. The same goes when you've gotten rid of all of your cartilage, because you've probably destroyed a lot of the cells that are creating it. And once they're dead, right? But having said that, I can tell you my own personal experience, as much as I've been on our products in the past, I'd have had rheumatoid arthritis since I was 28 years old. And again, we never say we treat, mitigate, cure, prevent, or do any of that. All I can tell you is when my bones ache and when they don't. And since I've been on this stuff, I sleep at night now and I don't have to turn all the time because my shoulder is bothering me. And that's a big deal. That's a big deal. And oh, by the way, I didn't happen to mention about sleeping. I have always struggled sleeping. And that was one of the first improvements I had with NRF1 and NRF2 that I was grateful for. But this is a whole nother level. Now it's sleeping and dreaming. Oh, I haven't heard anybody talk about that lately, but I can tell you that has been, in bringing that up to people, we've had so many other things to talk about. Everyone's like, wow, now that you mention it, yeah, I mean, pretty vivid. You know, it's been kind of crazy to me, but, and I'm happy to say they're happy. So that's a good thing too. But that's another thing, our mood. That's another thing that I think, there's a few people that I know when they first started taking it, and I think Kathleen might have been one of those people. Up front, I had a few people when they first started said, did you feel like a lift on this, like the first few days you were taking it? And the answer is, you know what, many people do. And I
had a calm clarity.
Yeah, definitely.
I feel a little lift as well.
Hey, Nancy.
Those are all components to things that we need. Our body's about balanced chemistry. Okay.
Nancy, you were mentioning something about the like periodontal disease and receding gum lines and all of that. And we actually, I don't know if you've seen the picture yet. I can send it to you if you haven't. But we have a distributor who is angry because she never took her before picture. And her gums are so much better now because they're moving back up because her dentist was so frustrated with her. And she was like, I never thought to take a picture of that, to have a before picture. And now she's just ecstatic about it.
Well, and I know, and it still grosses me out beyond belief, but I could not believe what happened with my legs.
Those are amazing. Yes.
I've had a few people call and say, do you have insurance on your legs now? But you know what? That was something that really bothered me. You know, and I've had so many doctors reach out to me to say, if there's one thing that women complain constantly about when they go in to see the doctor, is the crepiness of their skin. And part of it is because as we lose our muscle, there's looser skin and the crepiness happens. And so I do some of the content of it is the muscles. We're getting better muscle restoration and the elasticity.
That's amazing. That was amazing.
It is hard. I get what you mean about the pictures. It's hard because you have no idea how it's going to affect you. But the bottom line is these are things, our company is not going to come out with things that are not activation first. And that's what separates us from the rest of what's out there. And, you know, we'll continue to have other things come out that will be doing that because we have components we know we're going to need. And for me, the thing I'm most excited about is I think that this has been that next wave for us that we really needed. And there have been a lot of people that were kind of just comfortable where they were. And I think this has given us a whole new excitement level because of the things that we can do for so many people.
Amazing.
Awesome. Thank you.
I got a quick question.
Oh, if I can, go ahead.
I got one more quick one. Is there anybody that's not supposed to take or that should not take it? Because I have a customer, she said she's got a condition and she said, well, her body already overproduces collagen with that condition. And so would there be anybody that
You know
shouldn't
what?
take it?
We really do not have any contraindications for anything. And here's what I will tell you. The reason that she's being told that again is because what she's been able to take that were her choices only replenished. You have to understand, just like our NRF2 with the pulsatile action of biofeedback on and off and on and off, that's what activation provides. Activation means your own body is making its decisions, what it's doing with things. And you know what I tell people is if they've been being told, because we have a lot of breast cancer patients being told they cannot take it. And again, that the doctors are only basing it on the generalized information of what they've been told. And so they don't have a clue about what we have because they've never seen anything like this. When we have activation, it's a completely different story. The story does not change. Our bodies are wonderfully equipped to do a lot of things that we don't know how they do it or why they do it. I'm a breast cancer survivor since 2009, and I have a severe form, and I can tell you that I'm drinking it happily because I have no concerns whatsoever in regard to that collagen over creating, because my body's going to be activated to deal with it perfectly. One last thing I'd like to bring up, I've had a few people bring up that they're vegan, and I just tell them, look, you need to know and understand, you got to make some choices. Our marine-based peptides are hydrolyzed, so it's only the peptide left. If you're allergic to fish, you can still take this, okay? That's because we're taking the components out of what the fish cells are. These are the peptides hydrolyzed through water. And it's very complicated science, but the bottom line is this is providing your body what it needs so it can decide what it's supposed to do. And I would not have any trouble making that recommendation to anyone. Having said that, though, you might have them start slow. Have them start with 1/3 of a bottle, you know, see how they do. You know, that's always been my recommendation as a pharmacist and a pharmacologist. If there's ever, you know, if you're a super sensitive person, start really slow. Give your body a chance to catch up and see what it's going to do. And make sure that they're not just drinking out of the bottle and putting it in the refrigerator. Just have them pour it out because there's no preservatives or any of that kind of thing. Those are in glass bottles because they go in at 170 degrees. All right. They're put in glass bottles because we don't want any particles of plastic going into our bodies. We got enough stuff in there already. That bottle is glass for a reason, and it makes it the cleanest, purest, best product we can provide.
Is it okay? I know this isn't my Zoom, but my dad's been in the, basically, we were told in life, we got back from,
Utah.
right. So we got back there. I started him on, and I mean, he wasn't even able to, anyway, bad scenario. I started him on this collagen. He went home. He's home now and his brain works. And I want to know why. I mean, I'm just thinking it works on every tissue in your body, which includes your brain, which includes everything. This wasn't very long.
No.
He went home on Friday.
Well,
was
it's about
just
the
messed.
chemistry. That's it. This is about balancing the chemistry in the cells, and this optimizes that chemistry very quickly. And you know what? There's essential parts of it that, again, God's recipes, he knows way better than we do. And I'm grateful every day for the bodies he's given us and what we see from it. So all we're doing is optimizing what our own body can do. And I love that. Kathleen, thank you for sharing, because I know what a big deal that was for your family. And you know what? We're going to hear lots and lots more of these stories. It's really exciting.
But everybody looks at the outside. The reason why I'm sharing this is because what we're showing pictures of is the outside of everybody's body. You know, look at how those wrinkles went away and look at what my legs look like. And there is something deeper and bigger inside our bodies. And my 87-year-old father went from ICU to going home. And the only difference was this. So just saying, what's happening here? I know we're not supposed to say any of that. All right, bye.
Well, one of the things that I'd like to share real quick is that when I was talking to Michael Huey, he said, activation on the inside affecting the outside. And we've always had that activation. I think John kind of led to this at the beginning when he said, we're able to use this collagen as a way to introduce people to more activation. And people need to see it oftentimes. And so it's really cool to be able to have them see it on the outside and teach them that, hey, if it's this good on the outside, look and think about what it's doing on the inside. So huge deal. And we don't want to forget that. Nancy, thank you so much for your time tonight. You guys, we're about 40 minutes in. We better let everybody get back to what they're doing. Big thing to remember is not to forget about the Wednesday wellness. What a gift that LifeVantage is giving us. Being able to make sure and find those on Facebook, I'm sure, and you'll get them in your email and wherever else. They always do a great job of getting that information out. But Nancy, thank you for sharing your brain, your heart, your legs. I mean, come on. Even when you probably didn't want to.
I did not want to. I did not. But I had
so
to.
happy.
I had to.
Thank you so
it's
much,
like it's
Nancy.
a secret.
This
You
is
can't
amazing.
not share.
Thank you. You all are wonderful. I appreciate it. Each and every one of you. You all matter. Thank you.
Oh, appreciate it.
Thanks, Lance.
Good night, you guys.
Good
Thanks
night.
again.
Everybody, have a good night.
Thank you.